The pre-procedure ultrasonography of the axillary area is performed. The arm is abducted with the elbow bent at 90 degrees with the hand resting by the side of the head. A 38mm 7 to 12 MHz linear probe is positioned horizontally across the axilla at the axillary crease, with the notch facing laterally. The artery is positioned in the middle of the screen. The initial scanning is done in the nerve mode. The depth is decreased so that the artery is seen as a bigger structure on the screen. The nerves are seen around the artery as hypoechoic structures. Let us observe the changes in the quality of the image as we make some changes in the machine and probe settings. The grayscale is adjusted using the dynamic range button from 0 to +3. Note the difference in image quality. The scanning is changed to the vascular mode, and the machine is set to general or GEN mode. Note the difference in the quality of image. Now the machine is changed from the general to the resolution or RES mode. Note the superficial structures are seen in more detail, and the top of the screen looks very bright due to overgain. Adjust the gain. The arm is adducted while scanning the nerves. Note how the nerves move around the artery freely. The vascular or VAS mode is changed to nerve or NRV mode of scanning. Note the outlines of the nerves are seen more distinctly. Note a similar improvement with the image of the musculocutaneous nerve when the mode of scanning is changed from vascular to nerve. Pressure of the probe is released to visualize the veins. Note that the radial nerve in this patient is underneath the vein. Moving the probe more distally in the arm reveals a round hypoechoic shadow just below the artery. It has pulsations and disappears as the probe is moved proximally. This is the profunda brachii, a branch of the axillary artery. Choose the setting that works for you best. Some like the general mode, while others like the resolution mode. Similarly, some like the nerve mode, while others like to use the vascular mode for performing the block. Skin is prepared with an antiseptic solution. The skin is infiltrated horizontally across the crease. The probe is covered with an 8-inch tegaderm. A small amount of ultrasound gel is applied on the axillary crease. A 22-gauge, 50mm short bevel needle is connected to the nerve stimulator, set to deliver 0.6 milliamps of current. A 20mm syringe containing the local anesthetic is attached to the needle, and the needle is flushed free of air bubbles. The needle is inserted in plane from the lateral side of the probe and is seen to enter the field from the blue dot side of the screen. The nerve stimulator is turned on. The needle is advanced towards the nerve that is lateral to the artery at about the 10 o'clock position. Note that contact with this nerve does not always produce the motor response. The needle is allowed to touch another area of the nerve, resulting in median nerve twitches of the fingers. Injection of 1 ml of local anesthetic is not painful and is seen as a hypoechoic shadow near the nerve. Additional 5 to 10 ml of the local anesthetic are injected after negative aspiration for blood. Note how the nerve is pushed away from the needle tip. The needle is advanced between the artery and the skin to contact the nerve at the 1 o'clock position. Note the ulnar twitches of the fingers. 5 to 10 ml of local anesthetic is injected here. The needle is advanced between the artery and the vein to contact the radial nerve, which is running underneath the vein. This results in elbow extension. 1 ml of local anesthetic injected is shown to be outside of the triceps fascia. Additional 5 to 8 ml of local anesthetic is injected and is seen to lift up the artery away from the triceps fascia. Occasionally, the radial and ulnar nerves may be approached from the medial side, as shown in this video from another subject. Returning to our current patient, the needle is taken out and the probe is repositioned across the upper end of the coracobrachialis. This reveals the musculocutaneous nerve in the substance of the coracobrachialis as a boat-shaped stippled structure. The needle is inserted in plane from the lateral aspect of the probe, almost vertically, to contact the musculocutaneous nerve. Neurostimulation here results in contractions of the biceps. Additional 5 mL of the local anesthetic injected is seen to disperse around the nerve as a hypoechoic pool. The needle is taken out.